Stakeholders in the nation's health sector have called for a reduction in the misuse and overuse of antibiotics in humans and animals as concerns over the increased spread of antimicrobial resistance increases. Now, at the annual commemoration of the World Antimicrobial Awareness Week, stakeholders are advocating for improved understanding of AMR as concerns about its negative effect on the environment increases. Trust TV's Aisha Salihu reports.
Antibiotics are widely used for the treatment of infections in humans and animals. Experts say misuse and overuse of these drugs lead to antimicrobial resistance, whereby the drugs are ineffective against disease pathogens, as statistics show that the abuse of these drugs are rampant amongst middle and low-class Nigerians with limited access to hospitals, leading to a public health threat. This now begs the question of the way forward for control.
Factors such as self-medication, low level of health awareness, lack of access to clean water, sanitation and hygiene, poor infection prevention and control practices, and poor waste disposal practice are believed to largely contribute to antimicrobial resistance.
Our citizens should not just walk into a chemist or pharmacy and just make demand for antibiotics, because if you come to us and you ask for any antibiotics, we'll sell for you. They are OTC drugs, but you should tell us what is wrong with you, and then we'll prescribe the right dose and the right antibiotic for that particular illness.
The discharge of antibiotics and other antimicrobial compounds, such as disinfectants and heavy metals, into the environment has the potential to drive the evolution of resistant bacteria. These compounds are present in water, soil, pharmaceutical industrial effluent, and hospital waste.
On the One Health multi-sectoral approach, the Nigeria Center for Disease Control and Prevention, in collaboration with ministries, departments and agencies across agriculture, environment, water resources, health and other partners, are concerned about the rise and spread of AMR.
Almost 64,500 deaths they are attributable, and 263,400 deaths which are associated with AMR. The GDP loss attributable to AMR in developing countries, including Nigeria, has been forecasted to be 5 to 7% by 2050.
Components of the 5-year National Action Plan 2.0 and expansion of national surveillance are among solutions to curb the AMR spread.
Without having a full representative data, we are still challenged in terms of advocacy efforts to get the necessary action for policy actions, and even to attract the resources that are required to tackle this really big problem. Strengthening private sector involvement in AMR activities, integrating multi-sectoral AMR surveillance and response activities.
We've been able to bring to the fore the issue of the AWARE classification, which is the access, watch and reserve groups for antibiotics. And we believe that this effort, which the Federal Ministry of Health has championed, is one of the ways that when the classifications are incorporated into the essentials medicine lists at the national level, that we can be sure that prescriptions do not target antibiotics that can easily go bad or that we need in the most critical patients who are in the intensive care units.
To effectively curb the menace, experts want all sectors to join forces and encourage the prudent use of antimicrobials and preventive measures. Aisha Salihu, Trust TV News, Abuja.